Merci, Madame la Présidente. Les Ontariens sont frustrés. Ils sont frustrés parce que les salles d'urgence ont été fermées. Ils sont frustrés parce que plus en plus d'entre eux n'ont pas accès à leurs médecins de famille. Ontarians are frustrated because they know nurses and frontline healthcare professionals are overworked, underpaid, and burnt out as a result of this government's crushing Bill 124. They're frustrated because when they call 911, they are less and less likely to have an ambulance available to reach them quickly. Madam Speaker, Madame la Présidente, ils sont frustrés parce qu'ils voient toutes ces choses et qu'ils voient leur gouvernement parle et prendre aucune mesure pour y remédier. They're frustrated because they hear their government talk and take no action to address these issues, Madam Speaker. Now, I'd like to take a moment to address the growing challenge of Level 0 here in Ontario. Now, Level 0, for those of you who don't know, is the complete unavailability of ambulances to respond to a 911 call. In 2021, Ottawa paramedics spent more than 49,000 hours in offload delay at area hospitals. This resulted in 750 incidents of Level 0. 49,000 hours of offload delay at hospitals, Madam Speaker. The 90th percentile offload delay was 97 minutes, far exceeding the 30-minute benchmark. This means that paramedics are waiting over an hour and a half to transfer their patients to hospital. Plus que 90 minutes en retard à l'hôpital, Madame la Présidente. Now that's 2 paramedics and an ambulance stuck at a hospital because the hospitals are too backlogged to take them. That's 2 paramedics and an ambulance not on the road responding to emergency 911 calls to save someone's life. Now, Madam Speaker, in the first 7 months of this year, Ottawa paramedics have experienced 1,125 Level 0 events. In some cases, Ottawa has had 11 hours of continuous Level 0. 11 hours without an emergency ambulance available to respond. Now, imagine an ambulance not being available to respond to a 911 call because your spouse is having a heart attack or a stroke. Imagine it's your child who's just fallen off the deck and is unconscious and unresponsive. Imagine that for a moment, Madam Speaker. 1 in 10 people survive cardiac arrests that happen outside of hospital. 1 in 10, that's it. With cardiac arrest, the odds of survival go down by about 10% for every minute until a person is resuscitated. After 10 minutes, the risk of permanent brain injury is very, very high. Now, Madam Speaker, when my heart stopped, I was fortunate. The fire service was already outside dealing with a minor car accident, and they just walked into the gym. The paramedics were already on their way to respond to that car accident, Madam Speaker. I'm here today because of that fast emergency response. And I'm here today because the doctors and nurses at the Montfort Hospital had the time to spend with me, Madam Speaker. The Montfort emergency room is one of the rooms that was recently closed. For a weekend, Madam Speaker. Emergency room closed. Why were they closed? Because of the healthcare crisis this government has created. Now, it's no mystery what would have happened to me had there been no ambulance to respond. It's no mystery what would have happened had the emergency room been overcrowded or closed. It's no mystery, Madam Speaker, what would have happened. I would have died. That's what would have happened. And that's what will happen in Ontario if we do not address this problem. Level 0 isn't just a problem in Ottawa. It's a problem right across the province. It's in Hamilton. It's in the Valley. It's in the GTA. In fact, Madam Speaker, when there's a level 0 incident in Ottawa, guess who we call? We call the paramedic service in the Valley to come to Ottawa, leaving your residents without ambulances too. That's how it works. And we call the ambulances in Embrun and Russell as well. That's your government. That's your government not providing the funding. The province and municipalities pay for paramedics to be there for us. They don't pay for them to be conducting hallway medicine in our hospitals. Hallway medicine caused by the chronic underfunding of healthcare by this government. Hallway medicine created and amplified by Bill 124, leaving healthcare professionals underpaid, overworked, burnt out, and leaving emergency rooms in Ontario in crisis. Madam Speaker, it's time to make the healthcare investments that we need for our families and to repeal Bill 124 and pay frontline heroes what they're worth. Now, Madam Speaker, I don't come just with criticisms of this government, because I'd be here the entire 20 minutes. I come with a solution. The City of Ottawa is seeking $5 million in base funding to hire 42 new paramedics. Now, these paramedics will be strategically deployed to emergency rooms at area hospitals, so that the paramedics who arrive with patients can transfer them to these paramedics who will be permanently stationed at the hospitals. They've requested $5 million in base funding from this government, Madam Speaker, and I hope that this government says yes. I hope the government chooses to get this done, because it's imperative for families in Ottawa, it's imperative for families across Ontario that ambulances can respond to 911, that they can get people to hospitals quickly, that those hospitals are open and have the capacity to take them and save their life. Thank you, Madam Speaker.